Introduction. Heart disease is a type of disease that affects the heart or blood vessel. Heart disease is a class of disease that affect the heart and blood vessel, many of which are related to a process called atherosclerosis. Heart disease also is an umbrella term for any type of disorder that affects the heart. Heart disease means the same as cardiac disease but not cardiovascular disease. Cardiovascular disease refers to disorder of the blood vessels and heart, while heart disease refers to just the heart. According to WHO, heart disease is the leading cause of death in the UK, USA, Canada, and Australia. In Malaysia, according to the Department of Statistics Malaysia, heart disease continues to be a leading cause of mortality, accounting for 70% of death in medically verified in 2020. The causes of heart disease are many factors such as high blood pressure, high low decentral protein, cholesterol, diabetes, smoking, secondhand smoking exposure, and obesity. Aging is also one of the factors that lead to heart disease. Most of the risk of heart disease is a man older than 45 and women past menopause have the highest risk of the heart event.
Works to circulate blood through the body. The heart pumps 5 liters of blood out its very minute and to enter circulatory system if filled within 20 seconds. The heart circulates 200 gallons of blood up to the 1600 ml through the blood it reaches in one day. The pump blood contains oxygen and nutrients needed by cells to the body. Blood also carries carbon dioxide and toxic substances from to involved cell and carried to other organs to detoxification purpose. Blood pump the heart gas through the two circulation known as pulmonary and systemic. Heart. A healthy heart weight between 215 and 300 and greater. The difference in the heart can be seen through the gender when the male heart which is 218 gram and while the female heart is 220 gram. Heart rate. The normal heart rate is different for each person. The normal heart rate for adult is usually about 16 to 100 beats per minute. The heart rate difference occurs slowly during rest, while it beats faster during exercise. Through the heartbeat as well, it is able to detect health problems. Heart rate for children aged 6 to 15 years have a pulse rate of 60 to 100 beats per minute.
Assalamualaikum and hello to everyone. My name is Nurul Najiha binti Azman H22A0642. I want to talk about how the heart disease happens. Heart disease refers to any problem that related to heart such as coronary artery disease, heart failure, and arrhythmia. There are some different types of heart disease. They may affect the heart and blood vessels in different ways. Coronary artery disease, which also known as coronary heart disease, is the most usual type of heart disease. Coronary heart disease happens when the arteries that supply blood to the heart started to clog with plaque. Plaque contains fats, cholesterol, and other substances. It causes the arteries narrow and become harder, which can block the blood flow. This resulting to the low blood supply and causes the heart receive less oxygen and fewer nutrients. In the end, the heart muscle weakens and there is a risk of heart failure and arrhythmias. To be clear, when plaque builds up in the artery, it can be called as atherosclerosis. The plaque in the artery stops the blood flow which leads to a heart attack. Other risks for heart disease including obesity, insulin resistance or high diabetes, high cholesterol and blood pressure, being physically inactive, smoking, eating an unhealthy diet, and clinically depression. Congenital heart disease. A person who suffers from congenital heart defect is born with a heart problem. There are many types of congenital heart defects including atypical heart valves. Valves fail to open or close properly or it may leak blood. This usually occurs due to valve flap bulging back, which called as prolapse. Second, septal defects. A birth defect of a heart in which there is a hole in the wall which called as septum that separates the two lower chambers called as ventricles of the heart. It allows oxygen rich blood to moving back to the lungs and not being bumped to the rest of body. And lastly, atresia, valves that control blood flow from the heart to the lung is missing. Congenital heart disease can involve major structural issues such as the missing of a ventricle or problems with unusual connection between the main arteries that leave the heart. Most of the congenital heart defects do not cause any noticeable symptoms and only visible during a written medical checkup. Arrhythmia. Arrhythmia refers to an irregular heartbeat. It happens when the electrical impulses that coordinate the heartbeat not working properly. The heart may beat too quickly, too slowly, or too erratically. In some cases, arrhythmia threatens our life. There are various of arrhythmia including tachycardia. This refers to a rapid heartbeat. Second, bradycardia. This refers to a slow heartbeat. And the last is premature contractions. This refers to an early heartbeat. Dilated cardiomyopathy. In dilated cardiomyopathy, the heart chamber becomes dilated, which the heart muscle stretches and becomes thinner. Dilated cardiomyopathy usually happen because of past heart attacks, arrhythmia, and toxins, and genetic. This causes the heart become weaker and cannot pump the blood properly. It can result in arrhythmia, blood clots in the heart, and also heart failure. According to the American Heart Association (AHA), this usually affected people aged 20 to 60 years old. Myocardial infarction. Myocardial infarction, also known as heart attack, and it involves an interruption of the blood flow to the heart. This can destroy part of the heart muscle. Heart attack usually happen because of plaque, a blood clot, or both in a coronary artery, but it can also happen if artery suddenly narrows and spasms. Heart failure. Those who suffering heart failure, their heart is still working but not as well as the normal heart. Congestive heart failure is a type of heart failure that can happen from problems with the pumping or relaxing function. Heart failure can occur from untreated coronary artery disease, high blood pressure, arrhythmias, and other conditions. This condition can affect the heart's ability to pump and relax correctly. Heart failure also can be life-threatening. Hypertrophic cardiomyopathy. This disease usually develops when a genetic problem affects the heart muscle or inherited condition. The walls of the muscle become thicker and contractions become harder, which affects the heart's ability to take in and pump out blood. In some situations, an obstruction can occur. Hypertrophic cardiomyopathy may have no symptoms, but it can be worsened over time and lead to other heart problems. It is also the main cause of cardiac death among athletes and young people under 35 years old.
When does heart disease happen? Young and older. Heart disease does not only affect older people. Younger folks are experiencing it more and more frequently. This is partially due to the fact that heart disease-causing diseases are developing in younger people. Any age can be affected by heart disease and the causes that cause it. Younger adults, 34 to 35 age, who have high rates of obesity and high blood pressure are at an early stage of life risk for heart disease. The main three risk factors for heart disease, including high blood pressure, high cholesterol, and smoking, are present in about half of all persons. Age. As you age, your risk of developing heart disease increase. Genetics. Your risk of heart disease is increased if your family has a history of the condition, and studies have revealed that some genes are associated with an increased risk of developing specific cardiac disease. Routine of living. Unhealthy lifestyle choices such as consuming a diet high in saturated fats, refined carbohydrates, and salt, not getting enough exercise, abusing alcohol, and being under excessive stress might eventually increase your risk of developing heart disease. Medical disorders. Your chance of developing heart disease can be increased by having several medical disorders such as metabolic syndrome, high blood pressure, high cholesterol, diabetes, and obesity. Second, pregnancy.
Hormonal change and physiology. The complicated hormonal change and physiology of pregnancy may cause some of these diseases to manifest as new disease processes or as exacerbation of pre-existing conditions that the pregnant woman already has. Hypertension, diabetes mellitus, and congenital heart disease are pre-existing illness that can put pregnant women at risk for cardiovascular disease. Cardiomyopathy. The risk factors that cause cardiomyopathy is during pregnancy and the weeks after delivery, and the heart may even be more susceptible to this exposure. Cardiovascular disease. Pregnant and non-pregnant women share a similar etiology for ischemic heart disease. These people are at risk for ischemic heart disease due to variables like hypertension, high cholesterol, diabetes, obesity, smoking, and inactivity. Travel to poor country. Heart disease has become so out of control in part due to environmental and demographic factors. The fact that poor nations lack the kind of preventative treatment that can help stop heart disease. Despite being affordable and useful, drugs can be challenging to deliver to individuals who need them.
How to prevent heart disease? Management of the patterns. Firstly, quiet smoking. To help you quiet, look for support from medical professional or support group. If you regularly quiet smoking, your risk of developing heart disease will go down. Secondly, adopting a healthy. Consume a diet that is well balanced and full of fresh produce, whole grains, lean proteins, and healthy fats. Limit your cholesterol, sodium, added sugar, saturated fats, and trans fats. A balanced diet can lower cholesterol and blood pressure, protect the heart, and lowers the risk of developing.
Number 3 is keep your weight in check. Being overweight, particularly around the waist, raises your risk of developing heart disease. The first way to keep your weight in check is combine a healthy diet with regular physical activity and do exercise that can reduce heart attack disease, such as running, swimming, walking, cycling, and doing aerobics for 150 minutes or 75 minutes a week. Aerobic is also good exercise to reduce heart disease. Number 4 is controlling your blood pressure. This is due to the fact that hypertension or high blood pressure is a serious risk factor for heart disease. The first way to control high blood pressure is to stay calm, slowly to breathe as deeply as possible. This technique can reduce the stress you experience and lower your blood pressure. If the symptoms of high blood pressure are always bothering you, try to change your lifestyle in a healthier direction.
In conclusion, it should be mentioned that heart disease can be avoided and the various myths surrounding heart disease, particularly among women, are not necessarily true. According to WHO, more than 17.5 million people died in 2012 from cardiovascular disorder such as heart attack or strokes. 80% of premature heart attacks and strokes can be avoided. The keys to prevention are a healthy diet, regular physical activity, and not using tobacco products. There are also therapies available for heart disease before it becomes a problem, as well as for heart attacks during and after they occur.